Hello all, welcome to our first Lunch and Learn for 2025. This is part of an ongoing series for our policy Lunch and Learns. It is the first one with our partners from CHAMP, and it's our first one overall. But the goal of these programs is to help get more information out about various policies that exist throughout the state of New York. One of the questions we always got, or one of the concerns we always got during advocacy days, was people didn't feel like they knew enough about certain topics to discuss them at length or talk about them with the legislators. Mental health parity is one of those ones that's really complicated and it can be hard to talk about. So we worked with the folks here at CHAMP to do this program, and we thank them very much for their support and their services, their willingness to present on the topic. Uh, our next one will be on temporary disability insurance, paid family leave, all of those kind of benefits, and we'll continue on through this series about mental health courts or the 730 evaluations. But today we're going to be talking about, again, mental health parity. I'll put a couple links if you want to learn more about NAMI, if you want to sign up for our newsletters, if you want to hear about our Advocacy Day, as well as a link to the CHAMP program. But I'll turn it over to the folks presenting.
Thank you so much, James. I think I'm going to cover the first couple of slides and then hand it over to my co-presenter for a bit. So as James mentioned, we are myself, Carla Lopez, and Ryan Johnson are co-presenting today. There we go. About the CHAMP program and parity and related laws. So I am Carla Lopez. I'm the supervising attorney of the CHAMP program at the Community Service Society. And my co-presenter, who will say hello in a moment, is Ryan Johnson, the CHAMP project specialist at the New York State Council for Community Behavioral Health Care. And both of us work on the CHAMP program, which we will explain a bit more about in a couple of minutes. So today we're going to talk about what CHAMP is and how we can help folks in New York. We're going to provide a little bit of background around some of the disparities in health insurance that led to the creation of CHAMP, some laws that were passed to address those disparities, and how CHAMP is working to educate people about those laws and help them enforce their rights under those laws. And then some more, excuse me, I'm a little under the weather. Some more specific information about how to fight insurance denials through things like appeals and complaints. So for folks who aren't familiar with the Community Service Society, it's a nonprofit organization that's been around since 1843, working to promote economic opportunity for New Yorkers. We have a health initiatives department. It's our largest department now, that works to ensure every New Yorker has access to affordable, quality health coverage. We partner with New York State to help New Yorkers enroll in and use health insurance. And we do this through a variety of programs, including CHAMP, as well as other health insurance ombudsman programs related to other types of health issues, and a network of insurance navigators and enrollment assisters.
Thank you, Carla. For the next little bit, you will all be hearing from me. My name is Ryan Johnson. I am the CHAMP project specialist at the New York State Council for Community Behavioral Health Care. The council is a membership organization. We have 165 community-based organizations that provide recovery-focused mental health and or substance abuse or chemical dependence and addiction treatment all across New York State, the city and upstate. Our members offer a broad array of behavioral health services for the community, children and adolescents, individuals, families, and our objective is to protect and enhance the availability of behavioral health programs and services that meet unique needs of underserved individuals and families in their local communities. So my role with the council is devoted completely to CHAMP and the work that CHAMP does. And so we'll be going through just a brief time here talking about what CHAMP does and who is involved in the CHAMP network. So CHAMP is the statewide ombuds program. We help patients and providers, excuse me, I'm not under the weather, with health insurance coverage for substance use disorder, mental health, and then co-occurring issues as well. We're a joint project between OASIS and OMH. Why is CHAMP needed? Well, 29% of adults say they don't know where to find the care that they need. And so when someone is going through and saying, you know what, I think I need to get some help for my substance use disorder, or they say, hey, I need to find a mental health counselor to help me deal with some depression issues. Where do you start? And a lot of times folks will just start with Google, but that's not always the best answer. Not everybody you find on Google is qualified. Not everybody you find on Google is part of your insurance network, and you might have to pay out of pocket. And so generally speaking, folks don't necessarily know where to start to find the care that they need. It's also true that consumers are 3.5 times more likely to have to go out of network for their mental health or SUD care than they are for their medical or surgical care. So what that means really is like, hey, I've got health insurance, and when I go see a doctor, my health insurance pays for the doctor's visit. But when I go and seek mental health or substance use disorder treatment, I'm more likely to have to pay out of pocket. Anytime I'm going out of network, I'm more likely to have to pay my own money, and my health insurance isn't chipping in for this. Or if they are, it's costing me more, or it's costing me up front. And so these are barriers that ultimately keep people from accessing the services that they need. Because they might not have that money up front, or they might not be able to wait for that money from their health insurance plan, or the health insurance might not kick in at all. And so, there's some disparity between what your medical and surgical coverage is versus what your mental health and substance use disorder coverage is. And 60% of adults don't know that they can appeal a denial issued by their health insurer. And if you're have ever dealt with a health insurance plan and the documents that they send you in the mail, it's a lot of legalese. It can be very difficult to understand. For some reason, the font is always like some light gray and never like a dark black. And ultimately, you might get something in the mail and it might say, hey, we denied coverage for you. You have an opportunity to appeal that denial. Otherwise, your bill is going to be $150 for this service. And, you might gloss over it, you might not read it. And so folks generally don't know. They can appeal a denial issued by their health insurer. And a lot of times health insurance plans know, it's a difficult process, and this is where they make their money. So it's a difficult process, and a lot of folks don't know that they have the opportunity to do that. So CHAMP is here, and we're a free service, and we help folks by helping them understand what benefits their insurance includes and how to access them. We can also, and we work in all types of insurance. So we work in Medicaid, we work in the commercial space, we work in Medicare. So there's all types of insurance plans, qualified health plans, Child Health Plus, that, we are very knowledgeable about. And so as folks are trying to access benefits through their health insurance, we can help them understand what's covered. We can also help them find in-network providers. Again, saving them the out-of-network difficulty of paying upfront or paying out of pocket. We help assist clients with obtaining needed approvals. Sometimes to go see a specialist, you might need prior authorization to access out-of-network referrals because you can't find anybody in-network to provide the service. You have to approach your health insurance plan with, to gain access to permission for these types of services. And so we can help folks obtain those prior authorization, out-of-network referrals, things like that. When it comes to appealing denials of services, there's a lot of documents you'll have to submit back to the insurance plan to appeal that denial. We know what a lot of those documents are, what you'll need to collect. We can help you review what the insurance plan is asking you for and to request those documents from the insurer. Again, we help appeal denials of services and medications. We're not simply a call us and we'll tell you how to do it. We can tell you how to do it. We want to make sure that if you're dealing with appealing a denial, we're going to follow you through that process. We're going to help guide you through that process. It's not just here's some information and good luck to you. It's how can we help you along the way? How can we help you fill out the forms? What can we do to help assist you in the best way possible? And so, we really do help folks from the start when they call us until their issue is resolved. We can help folks switch or enroll in insurance coverage. So sometimes the health insurance barrier that someone is experiencing to accessing mental health or substance use disorder services is, I don't have health insurance at all. So you can call us, we'll help enroll or switch your insurance coverage depending on what your needs are. We work to identify parity and legal violations and help folks file complaints about these parity violations. And we're going to be spending a lot of time here talking about appeals and complaints. So Carla is going to be talking about that in a few slides. So you'll learn a lot more about the differences between appeals and complaints and how to do those things and to utilize our website to access those things as well. And we also provide referrals when folks need referrals. CHAMP is 12 community-based organizations and statewide networks that provide this service that is CHAMP. And so Carla from CSS, CSS is kind of the main hub of this hub and spokes model that we have of all these different agencies providing this service throughout the state. We have 3 specialist agencies. Those are listed across the top. We have the Legal Action Center, the Medicare Rights Center, and the New York State Council, which is where I'm from. It's really important to have some of these partners as part of the network. So, the Medicare Rights Center, for instance, is a really important partner because Medicare is a complicated insurance that a lot of people have. And so anytime we have complex Medicare issues, it's really great to have the Medicare Rights Center as part of our network to take these kind of complex Medicare issues. The Legal Action Center really focuses on parity issues and helping file, parity complaints with New York State and with the oversight bodies. So it's really great to have them on board as well. The council, as I mentioned, has 165 different member agencies around the state. And so we're really connected throughout the state to help folks if they're in dire need of some sort of referral or they need something to step up for them. The council can help kind of bridge that gap. And then throughout the state, and I'll show you this map, throughout the state, we have community-based organizations that provide CHAMP services for folks and can provide, that we call them CHAMP advocates because, they advocate on behalf of people in this health insurance space, overcoming the barriers that they might be experiencing. So depending on where you are around the state, you can see these colors are associated with the names of the agencies on the right. Anything that's in gray is still covered. It's covered by our CHAMP helpline, which covers the whole state. So you can access our CHAMP helpline. You see the number there on the bottom left. We also have a newish website, champny.org. A lot of the information shared on these slides can also be found there. Our services are free and confidential. I think it's really important to highlight the fact that we're a free service. So we work with really anybody, any type of insurance. So it doesn't have to be a Medicaid client. It can be, someone, maybe a loved one. A lot of times I give these presentations and I hear, from the organizer of the presentation, well, geez, I've been trying to find a counselor for my 16-year-old daughter and I haven't been able to find anybody to take her. No one's in network, no one takes our insurance. This is what CHAMP does. Like we help folks with these types of barriers. And so we work with everybody. And we're a free service. We do work in all languages. We work with translation services for some languages, but Carla can correct me if I'm wrong, but our helpline features some Spanish speakers on our helpline as well. And we work all across New York. So again, on the map that I showed you, you saw some colors that were associated with the community-based organizations and the CHAMP advocates at the local agencies there, but we do cover the whole state through our helpline. A little bit more about the background around behavioral health, like the disparities in coverage around behavioral health compared to medical and surgicals, and what laws have been passed and regulations promulgated to address those. So this kind of digs a little bit further into why CHAMP is needed. So, U.S. Congress found that there's a history of discrimination by health insurers when it comes to the coverage of mental health and substance use disorder treatment. So as a response to this disparity, federal and state laws have been passed to address these disparities. So some of the notable ones are Timothy's Law in 2006, really landmark legislation, first started in New York State that tried to address the disparity between behavioral health coverage and medical and surgical coverage, and required health insurance plans to cover at parity. The Mental Health Parity and Addiction Equity Act came later on the federal level, borrowed a lot from Timothy's Law in New York to create a similar structure that covered the whole country. Health insurance plans have to cover behavioral health, mental health, substance use disorder services at parity to medical and surgical. The Affordable Care Act and then multiple state laws and federal regulations around the MAPIA, we call it, have been promulgated to strengthen parity laws moving forward. But despite all of these laws being on the books, you probably could guess that insurers continue to provide disparate coverage for mental health and SUD benefits as compared to medical and surgical benefits. So there's a lot of proof around this. There's been a lot of studies shown by Milliman most recently in 2019, showed that New Yorkers had to go out of network for behavioral health care more often than they did for health care. So again, this is a decade after the federal law says that there needs to be parity. When we dig a little bit deeper, we see services are still not being provided at parity, and providers are being paid less than other healthcare providers for the exact same services. They might even use the same rate code when submitting it, but if you are a nurse practitioner, your rate's going to be this, and if you're a LCSW, your rate might be a little bit lower. And so again, this is an example of disparity despite the laws being on the books. And they did longitudinal studies to say, well, is it getting better? Is it just taking time for these health insurance plans to catch up to what the law has required for them and what the regulations around the law have required? But in fact, no, over 5 years, these disparities are getting worse. Here in New York, the Attorney General has repeatedly found health insurers violating parity-related laws, including a most recent report that was issued December of 2023, showing ghost networks of mental health providers. If you've ever called your health insurance plan and said, I'm looking for behavioral health care providers that are in network, or, I want to get family counseling, marital counseling. Sure, they'll send you a list. And here's a list of 40 different folks who are, or 100 different folks who are in network that you can access telehealth, in person. Here's all their expertise and their specialties. So you say, great, there's so many folks in network, and you start to call one by one. Okay, this person seems good. You call them, they never answer, no phone call back, nothing. Okay, you call the next one. Hey, I stopped taking your health insurance 5 years ago. I'm not in network anymore. Oh, okay, you call the next one. Yeah, I take your health insurance and I'm in network, but I don't have any openings for 3 months. Oh, okay, I'll go to the next one. Next one, next one, next one, next one. The Attorney General did this process with health insurance plans around New York State and found that 86% of the providers listed as in-network were either not reachable, no longer in network, or not accepting new patients. That makes it really difficult if you're out there trying to find a counselor, trying to find a service, trying to find a program to treat an immediate need. If you keep bumping up against a wall and no one's there to help you, part of that is because your insurance plan is not actively updating their network plan, not actively going out and finding new providers in your area, not removing them when they leave. So it's, again, creating another barrier for folks who are trying to access services that are in network, and they're wasting their time. They're, 86 out of 100 people that they call are not going to be able to provide the service for them. So again, we've been talking about parity throughout this whole time, and to dig a little bit deeper into what that term means, it's the opposite of disparity. Again, it's a word that you are probably familiar with, disparity more than parity. So the laws are requiring insurance benefits for these conditions, mental health and SUD, to be equal to coverage of other types of care. And so the language in the law requires that the coverage also is not more restrictive than that for physical care. So if you're saying, I'm trying to get to a mental health provider, your insurance plan shouldn't be requiring prior authorization to get to a mental health counselor, because they're not requiring prior authorization for you to get to your primary care physician. And so the law is saying, you can't make behavioral health care more restrictive than its cousin over here in medical and surgical care. So it's not a guarantee that you're going to get good coverage. Maybe your plan just has bad coverage in general, but it should be at least the same as what you would receive on the healthcare side of your health insurance, as we're talking about behavioral health care. And just to mention, that the law requires insurance benefits to be equal types of coverage. You can't have coverage limitations of, well, you can only spend $1,000 on behavioral health and there's no coverage limitation on the medical or surgical side. That's the type of coverage limitations we're talking about. So we're going to just briefly here put in a example to help folks understand. The first example is this. Your health plan charges you a $50 copay to see a psychologist, but it's only a $25 copay to visit your primary care physician when you're sick. Do we think this is a parity violation? We'll find out. The second example, your health plan has a combined annual deductible of $2,000 on all benefits. Just for sake of moving forward here, I'm going to show you that it is in fact example one, that is the parity red flag here. The laws and the regulations that are promulgated on behalf of those laws indicate, listen, it can't be disparate, right? It should be $25 for a copay for your psychologist if it's $25 for your primary care doctor. There are other areas of parity violations that we see a lot around medical necessity criteria, pre or prior authorization requirements that they're requiring for folks, drug treatment, prescription drug treatment design, fail first policies, what they do around, hey, you have to fail first on this medication before we'll approve what your doctor has prescribed to you, the network design and reimbursement rates. We could go a lot further into all of these, but I want to make sure that we have more time for questions at the end and for Carla to get through talking about appeals and complaints. But these are other areas we see parity violations in at CHAMP all the time. So more specifically, to drive down into network adequacy, just so folks know, your health plan generally contracts with a network of providers. And so you as a participant of your health plan would be required to use an in-network provider in order for your health insurance to pay for it. You might be able to use an out-of-network provider, but it might cost you more. It might cost you upfront with a reimbursement to come later. They might not cover as much of the provider. So it's not, as financially beneficial to go to an out-of-network provider oftentimes. The term network adequacy refers to the ability of a plan's network of providers to deliver the benefits that the plan promises. If they say, hey, as a part of our benefit package, we cover mental health counseling, but you can't find anybody who's in network, they're not delivering on their promise to provide that. So there are laws that say more specifically what counts as an adequate network, including recent regulations for mental health and substance use disorder that became active July 1st for certain health insurance plans. Carla, I believe, is going to get more into that on her slides. But again, generally speaking, we're, as a state and federal government, are requiring health insurance plans to have adequate networks for folks. But many CHAMP clients have difficulty finding those providers, again, facing problems like no providers accepting new patients, long wait times, no providers who are nearby, especially if you're trying to find something in person, no providers at all for certain types of care, providers listed as in network who don't take the client's insurance. And I'm going to end my portion here on a brief case example. We've kind of covered a lot of this stuff already. But Tanya, fully insured, employer-sponsored health insurance, contacted CHAMP for help finding in-network mental health provider for her son, Andy, who has obsessive compulsive disorder and needs exposure and response prevention therapy. She asked her plan for a list within a 30-mile radius of their home who could treat Andy, and upon providing a list of providers, she found numerous errors. People not in network, incorrect phone numbers, duplicates, no providers who were in network who were able to provide this to Andy. So Andy's condition was deteriorating. He began to see an out-of-network provider. She requested an out-of-network referral from her plan on the basis that the plan had no providers who could treat Andy. She had gone down the list. She had called all these folks. And so the plan denied. And they said, we have in-network providers who can treat him. And here, listed in the denial, is the name of in-network providers who they said could treat him. So Tanya calls the providers, and none of them are accepting new patients. So Tanya calls CHAMP, and CHAMP helped her appeal the plan's denial of her out-of-network referral request, and the plan ended up reversing its denial and agreed to cover Andy's care with an out-of-network ERP provider. But by the time the appeal was decided, Tanya had already spent over $6,000 out of pocket for care, which now she will be reimbursed for. So these are the types of issues that we deal with here at CHAMP. It's an important resource for you all to know. So in Tanya's case, this was an employee-sponsored health plan, right? A lot of the folks who are going to be on the call probably have insurance through that it's employee-sponsored. You know, this happens all the time, and it doesn't matter who you are or what type of issue you're having. We all face these issues with our health insurance plans and the barriers to access and coverage. I'm going to turn it now over to Carla, who's going to be talking about fighting insurance denials and other barriers to care. And we'll take questions at the end.
Thank you so much, Ryan. Before I launch in, and I know Ryan just said we would take questions at the end, but do you have any questions? Sometimes it's hard to remember at the end the questions that are popping into your head earlier in the presentation. All right. As Ryan said, we will have time at the end as well. Oh, and I just remembered I can't advance this. Thank you, Ryan. So in this section, we are going to talk about what you can do when care is denied by an insurance company. There's three big buckets that we're going to talk about today, which are appeals, complaints, and fair hearings. And we'll go through what each of these means. So appeals and complaints, I would say, are the main ones that we're going to focus on. An appeal is a way of challenging a denial by your health insurance company. So it's basically a formal process by which you ask them to reconsider a decision that they made and to reverse it. So if they said they're not going to cover something, you could file an appeal and ask them to change their mind. And a complaint is used more to report problems, more systemic problems with what a health insurer is doing, usually to a regulator of that health insurer. And it might be related to a specific denial or it might not be. Appeals, you have the right to file an appeal for certain types of things, whereas a complaint can be really about anything. So that can include things like poor customer service or delays in care, or trouble finding an in-network provider. These two different processes tend to, they have kind of different outcomes. The appeal is focused on changing a specific coverage decision, whereas a complaint is, again, it's a little bit more systemic a lot of the time, and it's trying to correct more administrative issues or potential violations of someone's rights or the laws, which are not mutually exclusive. Next slide, please. Whoop. Thank you. So we'll start with appeals. When you receive an insurance denial, including an explanation of benefits that you disagree with. So some people don't realize that an explanation of benefits, for those of us who have commercial insurance, you get the thing in the mail that says this is not a bill, and we're just sending you a friendly letter to explain how we are not covering your treatment. That also has an appeal right. So if you get an explanation of benefits that looks wrong, you can appeal that. But also when you receive a denial, that comes with appeal rights as well. And as I was saying before, an appeal is a process where you're asking an insurer to change their decision. Very important to pay attention to deadlines. I'm not going through all the deadlines specifically in this training because they vary a bit depending on what type of insurance somebody has, but they should be stated in any denial or any explanation of benefits. It should say exactly what the deadline is to appeal. If you miss an appeal deadline, you lose your right to appeal. And that's why it's so important to to pay attention to those deadlines. There are what's called internal appeals and external appeals. So internal appeals come first, and they go to the health insurer itself, where you're asking the health insurer to overturn its decision. As you may not be surprised to hear, those are less likely to be successful. Once someone has filed internal appeals, if the insurance company upholds their denial, then usually there is a right to an external appeal if the denial is related to medical judgment. So those are denials about things like whether something's medically necessary, whether it's experimental or investigational, that type of thing. An external appeal goes to something called an independent review organization. So instead of the insurance company making its own decision about its own denial, this is going to a third party to make a decision about that denial. And again, not every type of appeal is eligible for an external appeal, but if it's something related to medical judgment, typically it is. Next slide, thank you. A couple other things that I just wanted to note about appeals. So in addition to us, consumers, having deadlines by which we have to file an appeal, the plans, the insurers also have deadlines by which they have to make a decision on your appeal. If a plan does not make a decision within that time frame, for some types of health insurance, that means that their denial is automatically overturned. So it's a good idea to also pay attention to their deadlines if you're filing an appeal, because it might come in handy. And then I also just wanted to note that you do have the right to, excuse me, to ask for and receive information that your health insurer uses to make decisions about your care, including things like clinical criteria. This is another area where even though the law says that people have the right to this information, a lot of times when you ask an insurer for the information, they don't give it to you. So that's a good issue to potentially raise in a complaint, which we will talk about next. So some examples of things that you can appeal. You just heard one example when Ryan was going over a case that we had a little while back. Other types of things that you can appeal, and this is not an exhaustive list, include things like the very common, denial on the basis that something is not medically necessary. That's sort of the classic denial that you can appeal, but also things like a medication being denied because it's not the plan's preferred, medication. A denial of a request to see an out-of-network provider because you can't find one who's in-network. A lot of folks don't know that plans that are regulated by New York state law, which is, I would say, probably most New York plans, but not all of them, you actually have specific rights to go out of network, even if you don't have out-of-network benefits, if you can't find an in-network provider. It's sort of a slightly complicated process that CHAMP is happy to help folks with, but that process does exist and is something that can be appealed if it's denied. If a plan doesn't appropriately reimburse somebody for out-of-network treatment, we see this a lot. As Ryan was talking about earlier in this training, we know that people have to go out of network a lot more often for mental health and substance use disorder care than for other types of care. So then you run into, of course, more problems on the back end with things like how is that being reimbursed? And then denials of prior authorization are also typically eligible for appeal. Any questions on appeals? And again, we'll stop again at the end. Okay. Thanks, Brian. So as I said, complaints are a little different from appeals. When we talk about complaints, we're generally talking about complaints that are made to government agencies that regulate health insurers, where you're complaining that the insurer violated your rights or the law. They can be written and filed by anybody. You don't need a lawyer. There's no fee for filing one. Most of them can be filed online. Some of them can be filed over the phone. And then there's the snail mail option too for people who prefer that. We really encourage folks to file complaints, although it is, of course, it can be a bit of a pain sometimes to do it, because it causes the regulator to open an investigation into what's going on with the health plan. And sometimes, this is the way that systemic problems get corrected. The more complaints that are filed against a health insurer, the easier it is for the government to hold them accountable. If nobody complains about a problem, the chances that a regulator is going to discover it of their own volition are, I would say, somewhat slim. And then complaints can also resolve individual issues. At CHAMP, we've had lots of cases where we've tried appealing, we've tried going to the health insurer and getting something fixed, and they just won't do it. And so we've gone to the regulator and filed a complaint and ended up getting that person's treatment covered that way. So, examples of things that you can file complaints about. A big one is if you think your plan might be violating parity laws. Ryan talked about parity laws earlier, but if you think your plan is doing something that suggests they are being more restrictive in how they're covering mental health care or substance use disorder care compared to other types of health care. If your plan doesn't have any in-network providers who can treat you, that is definitely something to file a complaint about. If a plan didn't handle your appeal properly, if it gave you misinformation, if there are problems with the plan's directory of in-network providers. So this goes back to what Ryan was talking about earlier with the ghost networks. We see so many errors with these directories. It's really it does people a disservice, and they can't find the healthcare that they need. And if your plan did not correctly process your claims, unfortunately, we see that one a lot too, where it's just these sort of weird administrative hurdles and obstacles that health insurers put up that don't always have a clear process to correct. And sometimes the only thing to do really is to file a complaint. So on CHAMP's website, there are some tools and information about how to file a complaint, where to file a complaint, what happens after you file a complaint. Again, people can always give us a call too. We can advise folks on how to complain themselves, and we can also file complaints on people's behalf. Excuse me. I also just wanted to mention grievances, which is similar to an appeal in that it goes to your health plan. But I mentioned earlier that not every issue is appealable. Every issue is grievanceable. So the grievance process sort of exists for everything else, right? There's things that are eligible for appeal, like a denial based on medical necessity or a denial based on something being out of network and things like that. But you can file a grievance with your plan really about anything. Maybe they've mishandled claims, or a plan rep gave misinformation, or they didn't give you the documents that you were entitled to, like their clinical criteria. So I just wanted to note that this is also an option out there. And then fair hearings I wanted to mention because it's an important right for people who have Medicaid. This is only for people with Medicaid. So people who have Medicaid, they have the right to an appeal, and they also have the right to a fair hearing. A fair hearing is a hearing where an administrative law judge makes a decision about a health plan's denial or a reduction in services. People can represent themselves at fair hearings. They don't need a lawyer. They're still, I believe, all being held telephonically since COVID. So it's basically a phone hearing about your issue. This is another area, though, where deadlines are very important. Typically, there's 60 days from a denial notice to request a fair hearing. After requesting a fair hearing, you still have to wait for it to get scheduled, which can take many months, unfortunately. But those decisions are final. So sometimes for people with Medicaid, we say, file your appeal, and then do the fair hearing, because then you get two bites at the apple. Whereas if you just do the fair hearing first, that's a final decision. You can't file an appeal after that. Okay, so the CHAMP website, Ryan mentioned we have a somewhat new CHAMP website. It's champny.org. If you go to the next slide, Ryan. So there's a resources page on the CHAMP website, and you can see here there are tools about how to file appeals, how to file complaints, and other topics as well. And again, these are pretty general, high-level tools, and folks can always call us for more individualized assistance and more hands-on assistance. And we have some time now for questions if people have them. I saw someone asking about the presentation slides being available. I imagine yes.
Yes, if you guys are fine with that, we can add your presentation slides to the place we're going to post the recording of the webinar.
Thank you.
So what would you say the most common cause of a mental health parity violation grievance is?
It's interesting because for folks, and I think probably some people on this call are more familiar with the details of the parity laws, but there's the more what we call like low-hanging fruit with parity, and a lot of the low-hanging fruit has gone away. So things that are obvious violations, like limits on the number of visits you can have to a mental health provider when there's not that kind of a limit for other types of healthcare. And now it's the much squishier ones that are harder to prove. So things like inadequate networks, low reimbursement rates, um, lots of administrative hurdles, where it's sort of like, how do you, the consumer, prove that this is something that's being done disproportionately to mental health providers or people getting those services as compared to other types of healthcare. So I think those are pretty common ones. We also see things like with eating disorder treatment, for example, the plans will exclude coverage of nutritional counseling in the treatment of an eating disorder, but they cover it as part of treatment for medical conditions like diabetes. And the federal government has actually identified that as a parity red flag specifically, and that is something that we've seen over the years. But yeah, I would say a lot of network adequacy, reimbursement rate issues.
On that topic too, the New York State Employees Union is suing their behavioral health provider, Carelon. So they represent about 1.1 million employees that work for New York State. And, they've sued their behavioral health provider because of an inadequate network. And they've cite in their complaint that, there are multiple folks who have tried to gain access to services that haven't, that have called 1 million people and haven't had access to the services that are said to be provided. And so, there are actions that, especially, in the case of New York State employee unions, can take action against their plans in that way.
And I should have also mentioned clinical criteria. So both using inappropriate clinical criteria to make decisions about mental health and substance use disorder treatment, or using appropriate criteria but applying it incorrectly and ignoring, what's in people's medical records to deny care that really is medically necessary is another big one.
So do mental health parity laws, regulations apply to obtaining healthcare, specifically like pre-existing condition coverage? Or I know there's a bill we're looking at, so not to make it a bill thing, but there's one where people saw their coverage rates increase because they had obtained a prescription for Narcan, uh, and in some cases they were just an ER nurse. So I don't know if that necessarily meets the standards of mental health parity violation.
That's so interesting. I'd love to talk to you more about that. So the Affordable Care Act said that insurers can't um, discriminate based on pre-existing conditions. Um, so that came 2 years after the federal parity law. There may be some types of health insurance plans that aren't covered by that piece of the Affordable Care Act, in which case, yes, really anything that you put into the design of a plan that disproportionately makes it harder for people with mental health needs to get care as opposed to other types of healthcare needs is potentially a parity violation. I didn't know how deeply you wanted to go into parity specifics in this training, but I will also say it's worth knowing that Medicare is not subject to parity laws. There is a group of advocates who've been working for years to try to change that, but Medicare is not subject to parity laws. And neither is fee-for-service Medicaid, but most Medicaid in New York is subject to parity.
I did see a chat come through. Just is there any data that you all have as far as how many people CHAMP has helped?
We do, excuse me. We do have data. I'm not sure how much is publicly available, but we were launched in 2018, and I believe at this point have handled, I want to say about 8,000 cases. Off the top of my head, I should know that off the top of my head. Um, yeah, maybe 10,000. There is one report on CHAMP publicly available from 2 years ago on the Oasis and OMH website, and hopefully more reports will become publicly available as we move forward.
I would also add that a study in 2023 found that there were about 32,000 grievances challenging health coverage denials in 2023. Those are not specific to CHAMP, but that might give you a good picture of how many grievances were filed just in the state.
Yeah, another cool resource that exists is so the Department of Financial Services, the New York Department of Financial Services, is in charge of external appeals for many types of health insurance in New York State. And they now have a publicly available database of external appeals that they have overseen with little summaries of, the issue and the decision. And it has a bunch of filters. So you can filter it by like mental health, substance use, other types of health conditions. CSS looked at that database twice in the years since it became available. And both times saw that there were much higher rates of denials being overturned for mental health and substance use disorder care as opposed to other types of healthcare, much higher, which to us suggested that the denials were wrong more often for mental health and substance use disorder care than for other types of healthcare. Um, the unfortunate thing is, most people don't get to an external appeal because it's exhausting and it's time consuming, and people need treatment when they need treatment. And it can be challenging to wait for months and go through an appeals process. So, I think sometimes there's an argument that the appeals process takes care of the errors, but that's really it's an extremely imperfect solution. And a lot of people just they give up before they get to that point, understandably. But that database does exist. I can try to put the link into the chat if people are curious.
I think I found
Oh,
the link and put it in
someone,
the chat.
thank you.
So I know that that's definitely something we pay attention to, especially like we'll call the affinity to a complaint, like the how far down the road are you willing to travel versus what is the amount of effort it takes. You know, there might be a cost benefit analysis of we'll get X number of complaints returned, but that's still less than half. So we still made a fair amount of money off of not covering this thing. One of the other questions we had was, would you say the majority of the appeals are pre or post treatment, as in, are they clawbacks or retrospective denials, or are they mostly prior authorization or in the immediate?
We do both, but often folks can't wait for the appeals process to run its course before starting treatment. So, for example, in the case that Ryan was summarizing, I mean, that person spent $6,000 before the appeals came to an end. And a lot of people, most people can't do that. And that was for outpatient therapy. I mean, if it's, as I know you all know, if it's inpatient, if it's residential, if it's something more intensive, I mean, that's tens of thousands of dollars that somebody would have to put out if they wanted to kind of keep going. And then if they've decided they can't keep going and they're just not going to get the treatment, then they probably aren't going to keep pursuing the appeals process. So we are very willing and happy at Champ to help people with appeals pre-service, post-service, and to keep fighting it as long as the client is willing to keep fighting it. There are, I should say, I mean, I feel like I'm being a little doom and gloom about the time that the appeals process takes. There are expedited appeal rights that exist, and there are some that are specific to substance use treatment in New York State. So that is one way to move things more quickly. But when we do appeals, we often at Champ, we'll get all the medical records and really go through them, and that takes time.
I encourage anyone who has any questions to take themselves off mute and ask them now. If not, we'll move on to the more policy related side. I know there's a limit on what state organizations can do in that capacity.
I'm just putting, I know it's in here, but oh, there we go, the number into um, the chat as well. We're, always happy to help people over the phone and in person if we have an office nearby.
Okay, well, thank you to Champ for talking about this topic. It's always helpful to get a lot of really good information about what services are available. A lot of times we get questions about that through our helpline, and we will refer to you all as our folks in NAMI Westchester were mentioning. They've referred a few people to you all. But from the policy lunch and learn side, the advocacy lunch and learn side, we are also looking at bills to help kind of promote mental health parity, especially in as I've changed my background to. We've noticed that there will be the Medicaid cuts coming, or Medicaid money changes. So mental health parity has been an area where we've put an additional focus for our policy this year. We're looking at how much money can the providers get out of the system from the health insurance side for coverage that may have been subject to clawbacks or retrospective denials, or how can we clear the health system faster, get more people into treatment faster without as many prior authorizations. There's bills right now around prohibiting step therapy. As they've mentioned, there's bills right now around prevents discrimination by insurers based on individuals' mental health or substance use disorder history. There's one that prohibits retrospective denial of payment for substance use disorder treatments. It's a complex web that health insurance is. we don't expect all of our NAMI advocates to be experienced in the health insurance system and navigating these appeal systems, but hopefully presentations like this help people feel like they have a better ability to talk about. I'll do another quick plug for our next series, which will be on the temporary disability insurance and paid family leave. The sign-up form will go out hopefully by the end of this week. If not, it will be out next week. But that'll feature our partners from A Better Balance. It'll also be part of a series that will continue up until our next legislative session. That will have information on mental health courts, 730 exams, and potentially solitary. If anybody has any other questions, we'll end our time here. Thank you for joining us. We're right at the tip of an hour, so we know that some people only have that much time. Thank you all for coming today.
Thanks so much for having us and for everything you do.
Jamie, Amanda, do you have any questions before we close up the meeting?